In this video, we will explore the science of Muay Thai, better known as the art of 8 limbs, a scientific study of human movement and how these devastating techniques can affect their opponents. We will learn how Muay Thai fighters use different parts of their body to strike the opponent with power and precision, and what kind of damage they can inflict or receive.
To understand how Muay Thai works, we need to understand the anatomy and biomechanics of the human body, especially the joints that allow movement and stability. The joints are the places where two or more bones meet and are held together by ligaments, tendons, and muscles. The joints can be classified into different types, depending on the shape and function. Some of the most important joints for Muay Thai are the elbow, the knee, and the ankle joints. Let's take a closer look at each of them and how they are used in Muay Thai.
The elbow strike, executed in close quarters, is a highly effective but risky technique, often used with caution in sparring due to its potential for causing serious injuries. This move engages the ulna and radius, with the triceps brachii as the agonist muscle for elbow extension.
To perform an elbow strike, the Muay Thai fighter flexes the elbow and rotates the forearm inward, while moving the elbow towards the target. The elbow can strike various parts of the head, such as the temple, jaw, and nose. Depending on the angle and force of the strike, the elbow can damage the opponent's skull, brain, facial bones, teeth, or soft tissues. Elbow strikes are often used in close range or in the clinch, where the fighter can control the opponent's head and perform maximum damage.
Elbow strikes are powerful and can cause lacerations, concussions, or fractures to the opponent's head. The elbow is a bony projection of the humerus, the upper bone. The elbow joint is formed by articulation of the humerus with the radius and ulna, the lower arm bones. The elbow joint allows flexion and extension of the forearm, as well as rotation of the forearm and wrist.
It works like the point of a knife. All the force is being magnified by being concentrated in a small, hard area. Even if the elbow doesn't deliver a knockout, it will almost always leave a nasty cut and often end the fight. Conversely, the biceps brachii acts as the antagonist, controlling elbow flexion. With the force generated, it's not uncommon to see muscle tears in the triceps. Focus on strength training and proper technique to minimize the risk of injuries. Now, let's delve into knee strikes, a powerful and versatile technique, engaging the femur and the tibia. Knee strikes can be effective in both close quarter combat and mid-range encounters. Strengthening the muscles around the knee and ensuring proper technique are essential to avoid injuries during knee strikes. To perform a knee strike, the Muay Thai fighter lifts the knee and extends the lower leg, while thrusting the knee towards the target. The knee can strike various parts of the body and head, such as the abdomen, the ribs, the chest, the chin, the nose, or the forehead. Depending on the location and force of the strike, the knee can damage the opponent's internal organs, bones, muscles, or soft tissues. Knee strikes are often used in the clinch, where the fighter can control the opponent's body and head with the arms or hands.
Knee strikes are another effective technique in Muay Thai, as they can deliver significant force and damage to the opponent's body and head. The knee is a hinge joint that connects the femur, the thigh bone, with the tibia and fibula, and the lower leg bones. The knee joint allows flexion and extension of the lower leg, as well as some rotation. The knee also has a patella or kneecap, which is a sesamoid bone that protects the front of the knee joint.
Now, let's explore kicks, a dynamic and powerful technique. Kicks can be categorized into 3 parts: leg kicks, body kicks, and head kicks. To perform a kick, the Muay Thai fighter swings the leg and foot towards the target, while rotating the hip and pivoting on the supporting leg. The kick can strike various parts of the body and head, such as the quadriceps femoris, the gastrocnemius, the abdomen, the ribs, and the neck and head. Depending on the type and force of the kick can damage the opponent's nerves, bones, muscles, or soft tissues. Kicks are often used in long range or medium range, where the fighter can keep a safe distance from the opponent's attacks.
Low leg kicks to the thigh typically target the sciatic nerve, which can easily impair the opponent's mobility. The sciatic nerve is the longest and widest nerve in the body, running from the lower back to the lower limb. It is composed of 5 nerve roots that branch off from the spinal cord and bundle together to form the sciatic nerve. The sciatic nerve is in junction with the muscles and skin of the posterior thigh, the leg, and the foot.
When a low kick strikes a thigh, it can damage the sciatic nerve by causing inflammation, compression, or trauma. The impact of the kick can also cause muscle spasms, swelling, or bruising in the thigh, which can further compress the nerve. The damage to the sciatic nerve can result in pain, numbness, tingling, or weakness in the affected leg. Depending on the severity and location of the nerve injury, the opponent may lose their ability to flex or extend the knee, ankle, or toes, and to rotate the hip or foot. This can impair their balance, stability, and movement, making them vulnerable to further attacks or falls. Body kicks to the liver can affect the person being kicked and cause severe pain and damage. The liver is the largest internal organ in the human body, weighing about 1.5 kilograms, and located in the right upper quadrant of the abdomen, below the diaphragm.
When a body kick strikes the liver, it can cause damage to the liver by causing inflammation, bleeding, or rupture. The impact of the kick can also cause the diaphragm to contract involuntarily, resulting in a sharp intake of breath and a loss of air. The damage to the liver can trigger the activation of nerve endings in the liver and the surrounding tissues, which can send pain signals to the brain via the vagus nerve. The vagus nerve is the longest cranial nerve in the body, running from the brainstem to the abdomen, supplying sensation to various organs such as the heart, lungs, and intestines.
The pain signals from the liver can cause the brain to respond by increasing the heart rate, blood pressure, and respiratory rate, as well as releasing stress hormones such as adrenaline and cortisol. These physiological changes can cause the person being kicked to experience symptoms such as nausea, vomiting, dizziness, sweating, and fainting. Depending on the severity and location of the liver injury, the person may also develop internal bleeding, shock, or organ failure, which can be life-threatening. Previously, we learned about low kicks and body kicks, two of the most common and devastating techniques used in Muay Thai. Now we will learn about the head kick, one of the most powerful and spectacular techniques. A head kick is a variation of the Muay Thai roundhouse kick, which involves swinging the leg and foot towards the target while rotating the hip and pivoting on the supporting leg. A head kick targets the head and neck of the opponent, aiming to knock them out or inflict serious injury.
Head kicks. Executed at a higher level, aim for the face and head. The jaw, mandible, maxilla, and the zygomatic bone are susceptible to fractures. Shots near the temporal bone can be particularly effective due to less protection. Precise technique and cautious training are essential to avoid injuries in head kicks.
A head kick needs to be set up perfectly, as it exposes the kicker's leg and body to counterattacks. A head kick can be set up by using feints, combinations, or angles to distract or mislead the opponent. A head kick can also be performed with either lead or the rear leg, depending on the situation and preference of the kicker. The head and neck are very sensitive and vulnerable areas of the human body, as they contain many vital structures such as the brain, spinal cord, eyes, nose, and the mouth. The head and neck are protected by the skull, facial bones, and cervical vertebrae, which are the bones that form the neck and support the head. The head and neck are also innervated by many nerves, such as the cranial nerves, the cervical nerves, and the brachial plexus, which are networks of nerves that control the sensations and movements of the head, neck, and upper limbs. When a head kick strikes the head or neck of an opponent, it can damage these structures by causing concussion, fracture, dislocation, and trauma. The impact of the kick can also cause the brain to move inside the skull, resulting in brain injuries such as bleeding, swelling, or bruising. The damage to the head or neck can trigger the activation of nerve endings in the affected area, which send pain signals to the brain via the spinal cord. The pain signals from the head and neck can cause the brain to respond by increasing the heart rate, blood pressure, and respiratory rate. These physiological changes can cause the person being kicked to experience symptoms such as headaches, drowsiness, confusion, blurred vision, ringing in the ears, or loss of consciousness. Depending on the severity and location of the head or neck injury, the person may also develop neurological deficits such as memory loss, speech impairment, paralysis, or coma, which can be permanent or fatal. Throughout this video, we have learned about the main fundamentals of Muay Thai. We have explored how Muay Thai fighters use their elbows, knees, and shins to strike their opponents with power and precision. We have also examined the anatomy and biomechanics of these three fundamental techniques. We have seen how these strikes can target different parts of the body and head, and what kind of damage they can inflict. Muay Thai is not only a sport, but also a way of life that reflects the culture and history of Thailand. Muay Thai requires physical and mental toughness, as well as respect and discipline. Muay Thai is also a great way to improve your fitness, self-defense skills, and confidence. Whether you want to compete or just get fit, Muay Thai can offer you many benefits and challenges. Thank you for listening.